Hi everybody. I'm going to be asking you frequently, can you hear me? No. No. Right, is that better? Yes. I've got a soft voice and so I will need to stay here. One of the things I said to the Five Good Friends people earlier was that I'm very short as well, and I was really worried about seeing you people here at the front, but you know, if I go on tiptoe I just about can. So you'll have to eyeball me. I'm really pleased to be able to talk to you about hearing and hearing as we age gracefully, because it's going to be more and more important. And you know, people just don't know how important it is. Now, are you all hearing me over there? Yes, good. Well, as I was getting ready to come today, I was looking for some photographs to use and thinking of my mum, who spent the last 10 years of her life not being able to hear well, and it sort of went off gradually. And I remember thinking first, I was a bit embarrassed about her speaking quite loudly in different social engagements. And then I noticed that she couldn't really, I stopped telling her those intimate little details that make a relationship really worthwhile, because it just took so much time out of the time we had together. And then I came across a photo of her talking to my first grandson, which would be her first great-grandchild. And I thought, she's talking there and Ollie, the little boy, would be hearing her, but I think that was the last time that she was able to talk to her great-grandchildren, because her hearing just went off really, really poorly. She got hearing aids, but she didn't wear them because she thought they made her look old. So I'm going to talk to you today about some ways around that, and how the community and the people who care for you, the people who love you, are the most important people who will help you to keep it all together. But most importantly, what I do know is that taking care of your hearing health as you age is like an insurance policy against cognitive decline or decline in thinking skills. Some people eventually will be labelled with dementia or Alzheimer's or something like that. But hearing is quite caught up in that process. But to illustrate to you how and why, I'd like to tell you first about my work with children and how we've found how important the brain is in all of the acts of hearing. So we consider that the brain is the organ of hearing, not the ears. The ears are just the way into the brain. And if a child comes along who's deaf, what we do at Hear and Say is we first get the audiologist to work so that we can unblock that pathway to the brain. And once we've done that, most of the brains are normal. And providing we have enough listening going into them and enough people talking in a loving way and in ways that engage the children, then they are able to grow their brain enough to be able to learn to listen and speak. So it's that story that I'm going to spend on the first half, so you'll see what I'm thinking. And then in the second half, we'll be talking about, as we age, some of the things that could happen if you don't care for your hearing, and then some of the things that you can do about it. I'm quite happy to answer questions, but probably we'll leave them till the end so that everybody can hear the questions together. Is that okay? Great. So I've called the title of my talk, Conversation Protects Your Brain. Here to stay social. So both the hearing part and the social part are the two key ingredients that will protect your brain. So 244 Australians are diagnosed with dementia every day. There's about 450,000 Australians living with dementia at any one time. And every day, 1 in 10 Australians over 45 years of age live with dementia. And we expect 1.1 million people to be diagnosed by 2056. So it's something that's going to happen unless we do something to prevent it. But I have some good news to tell you. Now, I'm going to talk to you a little bit about the children. I had a dream and I dreamt that I could address the most common disability in newborn babies. And that, believe it or not, is hearing loss. It's hidden, it's silent, nobody sees it, and people don't realise that of all the babies born everywhere in the world, that it is the most commonly diagnosed disability in all those children. And there are 360 million people worldwide with a hearing loss, and out of these, 32 million of them are children, and those are World Health Organization figures. So this was really rather a wild dream, but I felt that there should be some way that we could do that using the technology that I knew that was coming. Now, something that Simon Lockyer referred to before that started my journey off was the story of the boy on the road. I started my working life as a speech pathologist working with adults who had strokes and head injuries. And I was running up the hill behind Princess Alexandra Hospital in Brisbane one day to test a gentleman who'd had a stroke overnight. And as I was running, I came across this young 15-year-old boy in the gutter screaming, and he wouldn't stop, and I couldn't get him to stop. So I thought, he's been hit by a car, he's really badly injured, and was running up the hill to find a doctor, when a lady came out of the nearby house and she signed, speaking of hearing, she signed to the boy, "Are you sick?" And the boy signed back, "No, my bus money has rolled into the drain." And I realised then that he was deaf, and that was the deaf school, which I should have remembered, and that I couldn't talk to him and he couldn't talk to me. And so when I got an opportunity to work with deaf children just a few years later, that story has stuck by me and it's given me the motivation to persist all these years. So, knowing the story of the boy on the road, when I got a chance to work with deaf children, I found I really liked the area, but very frustrated. I found that parents wanted their children to listen and talk, and nobody taught them. So I found a person who could teach me. I went to the Canadian clinics and learned how to do auditory verbal therapy, which means listening and talking for deaf children. And I came back and in 1991, 1992, started the Hear and Say Centre as a not-for-profit, turning 6 children from my private practice into the not-for-profit practice straight away. So here's a picture of 2 of our early children. This is Megan and Bradley. Bradley came from up north and Megan was a Brisbane child. Both of these children had severe to profound hearing losses. Both of them were needing some form of hearing device which wasn't then available, but I knew that the Bionic Ear or the cochlear implant had been invented and was coming. What I didn't know was just how good it really is. So, as you see there, Megan's got a half head shave for her surgery. Bradley was going to have his quite shortly. We don't do the half head shave anymore. The implant fits in a little crease behind the ear under the skin. So none of that anymore, but it was the beginning. I'm sorry, I'm not sure what's causing that. Next slide, thanks. So here's a picture of a cochlear implant or a bionic ear. And it works with an outside device which is hooked up to that implant that's inside under the skin, and then down into the cochlear of the ear, which is a small, little tiny snail shell-like structure at the size of the tip of my little finger. So it curls round and round like this. And that we have an implant electrode with 22 tiny electrodes on it that the surgeon pushes into the cochlea and around the curls of the cochlea. And then we hook the child up with a microphone, a transmitter, and the sound that is picked up by the microphone, turned into an electronic signal, goes into the implant and straight to the brain. And the minute we turn the children on, they can hear sound. Now you're going to actually see that in a few minutes just to get the idea. Next slide. Thank you. Thanks, Sam. This is Professor Graham Clark who invented it. Graham Clark is an Australian, ENT, lived in Melbourne, still living. What he did is he was working in a pharmacy store that his dad owned when he was a medical student. And his dad used to have all these people come into the pharmacy, and they used to talk to him about intimate topics often, and his father used to talk back too loudly on these intimate topics, and young Graham used to get very, very embarrassed. So he decided he would try and bypass the damaged hearing cells in that cochlea, the little snail shell, to see if he could bypass the damage for his father. And that's exactly what he did. It's a long story and very well documented. But sitting on the beach one day, he had this breakthrough in his brain. He picked up a blade of grass off the beach and found that if he wove it through a conch shell, which has a round and round shape to it, he could actually get a product that would go right up the waves of the cochlea. And using that idea, just that little blade of grass, he got the idea of what to do so that he could complete the cochlear implant or bionic ear he'd been working on. And so the bionic ear was born. The bionic ear came to Brisbane just after I'd started Hear and Say. Next slide, thank you. And here's young Megan here after she's had her implant. And I kind of think she's saying, soon I'll be able to hear and speak and read. I can become whatever I dream. Now, we didn't know that in those days, but that's indeed what she did. Here's Megan in Paris on her gap year, and she was travelling on her own around Paris. No companion to travel with, and she's now got several degrees and is approaching a third one. So she's done extraordinarily well, but she's not outstanding. She's our typical child because the technology works, but only if we teach the brain to use it. And that's the trick that most people don't know. So we have to teach the brain through the parents to feed in really good fun plays and games, and then talk to the child enough so that they get lots of practice, because what we want to do is to turn their rudimentary brain pathways for listening from little rutted lanes into 6-lane freeways. And that's the idea. We need people to be able to hear, understand and speak. Oops, I'll have to stop waving my arms around here. So this little video now, you're going to see, it's very, very quick. It's Emily, a little baby. She's about 8 months, I think, old, and she's going to hear for the first time with her cochlear implant or bionic ear, and that's her mum sitting next to her and her dad's just behind that. So you'll see her, the audiologists are feeding sound in. Now you'll see her still there. That's her first sound. It's a very emotional moment. If you've ever seen it, it's a very emotional moment. So the whole family's in tears, and all the family who are watching on iPads all over the place are absolutely taken as well. And that was the moment that her life changes from black and white into rainbow, because she will now have the ability to hear every sound of speech from a distance of 6.5 meters. She can sit in a regular classroom and she can learn to listen and talk just like a child with normal hearing. Hear and Say grew and grew, and we went everywhere. Here's a little child out in Winton, one of our children, but using teleschool, we went all over the state, and we found that we had to open new branches. The closest one to here is Townsville, and then this southern way, it's the Sunshine State, but the Sunshine Coast, but we have 5 centres, plus our telepractice program. We found the magic key. The magic key was the brain. Newborn hearing screening first, then new hearing technology, either digital hearing aids or cochlear implants, and then using a parent-focused approach to teach the brain to listen and to talk. So those are the 3 key ingredients: starting early, getting the technology on and all day long, every waking moment of the child's life, and then teaching the brain to use it. Thank you. So at Hear and Say, we do this every day. Here's just one of our dad's groups looking after their babies. So we have some 900 children at any one time that we're teaching to listen and to talk, whose lives will be forever changed. It's a gift that can never be taken away from them. And we have many ways of developing the brain for listening and speaking, but also for reading, because if you develop and maintain the brain for listening and speaking, you also maintain your brain for reading and learning to read. And growing children's brains is what Hear and Say does. And now I'm here to tell you about how you can keep your brain with those 6 lane freeways so that hearing, listening, understanding and talking happens instantaneously, and you can keep those conversations, those intimate conversations going that will give you the relationships that make your life meaningful and fulfilled. We can give the children unlimited possibilities for listening and speaking and reading, and they can have the world they dream of. I put this slide here in the middle of my changeover between the child section and the adult section, because what it does is it encapsulates the whole process. So you have on the left here the parents and the family, and then we have the ear, which has now been fixed, giving access to the brain. And because we're teaching the brain, we get normal listening, spoken language, communication, and all the other things that we need. So that's just to give you an idea of that process. Now, not many people break it down like that. So in a moment, we're going to look at some of the things that you can do to keep your brain fit and healthy. Now, I got this off the net on the weekend. And if you see it, can you all see? You see down here? Okay. You'll see that there's a lot of things that you can do, but there's not one mention of hearing. And what the research is saying is that it is the most important thing. So societies around the world are concerned about people losing brain cells and other forms of cognitive impairment that affect many older adults. And these brain changes typically appear years before. So we have a window of time that we can do something about it. The next slide gives you the evidence. Now, this is a slide that came from The Lancet, which is the top British medical journal, dated 2017. And it's a story of dementia and how an adult's brain may be affected over the years. So they start off at birth, and then this curly line goes down to the end of life here. But the most important bit is this bit here. Midlife. And why that's important is that it's midlife, and having a hearing loss in midlife that is untreated, that is the most important worry point that you can have for your brain. So out of all the things that you can do for your brain, and that's all sorts of reasons, there's 65% you can't do 65% of risk for dementia you can't do anything about, but 35% there is something you can do about it. And of all of these, genes, education, high blood pressure, obesity, smoking, depression, lack of exercise, social isolation, diabetes, out of all of these, the one that gives you the biggest bang for your bucks and the biggest insurance policy is hearing. And people are only just starting to realise it. So that's The Lancet from 2017, and the name of that author is Livingston and others. Recognising and treating hearing loss in midlife can give a reduction in 9% of the new cases of dementia that are diagnosed, which is very significant considering that there's just 35% we can do something about. The rest of it's in our stars, and that's even more than genes. Next slide, please. The good news is that our brain changes can be slowed by wearing a hearing device. And that's the bit I'm here to talk to you about. When you start losing some hearing, you're not only losing sound, but your brain capacity is changing, but all is not lost. This is Professor David Ryugo. He's currently working in an Australian, but he's an American. And when he goes into a restaurant, he brings out an app on his iPhone and he checks the noise levels, because he doesn't want to stay if it's going to be too noisy. And he wants to leave that restaurant because he knows he wants to maintain his hearing at the right level. But he also knows that he needs to wear hearing aids the minute that he finds a hearing loss. And he needs to not only put them on, but like the children, he needs to wear them 100% of his waking hours. Now, how many people have you heard say hearing aids don't work? This doesn't work, that doesn't work. But there are reasons for that. So I'll explain that to you now. But noise particularly is to be avoided, because noise is like radiation or ultraviolet light. A little bit won't hurt, but it's accumulative. It all adds up. So noisy machinery or something like that, all these young people in nightclubs, that's a big no-no. The last decade of a man's life is usually spent with hearing loss. Now, we're going to talk about men, but I have to make the point that Dr. Alan Finkel, the Australian chief scientist, said last year that for the first time, the cause of death in Australian women is now dementia. It has actually passed hearing loss in causal factors. So we're speaking about something that's really, really significant. This grumpy fellow is Brian. And I'm sure all of us know some Brians, and I'm sorry if it's a male picture, but the Brians of this world are the hardest to get the message through to. By 70 years of age, 75% of adult males have significant hearing loss that could be caused by lots of different things, but it will be enough to keep them socially inept, not being able to react and talk to people and be able to take part in community. And it's community that keeps us alive. Community and relating to the people we love that keep us alive. So here's Brian's story. Brian is a farmer. He has a severe hearing loss caused by machinery on the farm. He's sat on a tractor a lot of his life. Brian is also grumpy most of the time. He's a typical Australian male in that he cannot hear what others are saying, but he will wait 10 years before he visits the audiologist or the hearing aid shop and asks for a hearing test. So that's the average, 10 years of waiting. Then he may or may not try the hearing aid, and he may not put them on. Usually he doesn't. He usually says they don't work because he only wears them sometimes and only wears them when he needs to. But he's absolutely not known the fact that you have to learn, your brain has to learn to use a hearing aid. Then he doesn't persist with them or wear them full time when he's awake. He's never tried them out for a good 6 weeks with lots of talking practice with somebody who cares for him and has the patience to take the time with him. And let his brain adjust to their speech. He doesn't have special practice directed by a specialist. And that's mostly because there's not a lot around. Hear and Say are going to fix that. I'll tell you a bit more about that soon. He usually keeps his hearing aids in the top drawer and tells everybody vehemently that hearing aids don't work and how much money he's had to spend on them. By 70 years of age, some 75 men in industrialised countries will have significant hearing loss that affects their ability to communicate and makes them avoid making social relationships. Most importantly, deafness can also cause brain changes that cannot be reversed. and this is untreated deafness. The changes can be slow and imperceptible, and the changes will affect the ability to communicate, social relations, and brain changes. Men in this age group, now this is my husband's message for you. My husband has a hearing loss. Guess who talked to him about that hearing loss and said he needed to do something about it? Now, nagging did no good. What I had to do was to say to him, you know, I feel pretty awful and really tired when I have to repeat things over and over again. And our house isn't really good for people with a hearing loss. But I feel that it makes me feel unwanted and unloved. And that made him go and have his hearing tested. And we found it was a lot worse than we thought it was. So he's one of the lucky ones. He's got his hearing aids on as soon as he needed them, and he was able to put them on, and like spectacles, they worked. But most people, that doesn't work for. You really have to train your brain to use it if you've left it too long. And he said to me, I need to tell you, he speaks about men's health often. He runs some prostate cancer support groups. And he said that I have to tell you that men in this age group often continue to play out their traditional male role inherited from generations of chivalry, and they have to be seen as stoic and invincible. They assume a position of strong denial if there is any sign of failure or weakness, allowing their authority to be challenged, and especially if they do not feel they're seen to be fulfilling the role of the 3 Ps, to protect, to provide, and procreate. And they often don't want to own up to the fact that they need to take the responsibility to act on them by themselves. So that's his message for you, which he's found working with his male groups that he works with on the treatment of prostate cancer. But I think that it's just as applicable to areas like this, where males are usually the last to go get their hearing checked. So deafness is one of these situations, one where denial of a hearing loss can lead to vast changes in quality of life and to the brain. And the longer you leave it, the worse it is. Sorry, I've just got to change my iPad over. Now, staying social affects our health. Cuddles, kisses, and caring conversations, with the accent on the conversations, are the key ingredients of our close relationships. And scientists are finding that our links to others have powerful effects on our health. The relationships can be romantic, or family, or friends, or neighbours, or other social connections. But loneliness and social isolation are linked medically to poorer health, depression, and an increase of early death. Social relationships help reduce stress and heart-related risks, and particularly physical contact releases brain hormones that make us feel good and have other positive benefits. But our involvement with other people in diverse situations mean that it's really important to have that hearing base, that hearing health, which helps us to carry on with those intimate conversations. Did you know that if you're over 50, joining one social group cuts the risk of depression in the next 2 years by 24%? And by retiring and giving up group membership after retirement cuts quality of life by 10%, and the life expectancy decreases by 3%. And so it goes on. It's really important that we stay social. One of the things I've been lucky enough to be able to work on, because I know this, is I've been working on a little hearing device which is called a banter, because it refers to the light-hearted conversations that you can have over a dining table or over a coffee table with friends. And what the banter will do when it's finished, it's still being worked on in China, is it will allow you to have a Bluetooth earpiece in the person's ear with the hearing loss, and a little microphone that clips onto the person who's speaking or goes on the table. So with the background noise, it will help to take the message straight from the speaker to the ear. So I'm hoping that you'll hear a lot more about the banter a little bit later on in the year when we're able to bring it out. And I've also been lucky because Advance Queensland has given me a grant of $100,000 to produce this. So it's called Ignite Ideas, and there's a wonderful grant on in its 4th round at the moment for anybody who's got any startups. So 70% of people in Australia who would benefit from a hearing aid don't. A little thought about the young people in your life. Noise-induced hearing loss is irreversible unless you get a cochlear implant. It doesn't change the damaged cells in your cochlea or your brain. 1.1 billion teenagers are at risk of hearing loss due to the unsafe use of personal audio devices. And if you can hear the music from their earbuds, it's happening. Just tell your family. The other danger point is playing a musical instrument, and little do people realise that this can also cause some hearing problems. I know that someone in England fairly recently sued one of the big orchestras because they played the flute in front of someone who was playing the cornet, and they got a hearing loss from that noise in their ear. So it's really important that you tell your family too that if they're playing hearing instruments in a noisy band, they might need to wear an earplug that cuts down perhaps 25% of the sound so that they can preserve their hearing. These are just some of the little practical things that you can do. The economic cost to Australia of hearing loss is $33.3 billion per year. Now, having said that, about 35% of adult hearing loss is preventable by different medical reasons or by using all sorts of interventions. So the minute you need it, get that checkup with someone who's a professional audiologist. There's 3.6 million people in Australia in 2017 who are expected to be deaf, and this is going to more than double to 7.8 million by 2060. So this is a problem that's not going to go away. By 2060, 1 in 5 people will have some sort of a hearing loss. And of course, the baby boomers will be everywhere. So there's reasonably strong evidence of the association between decline in hearing and your cognitive ability and dementia, but it's not a direct one-to-one. I can't say that by putting on hearing aids you prevent dementia. What it is, it's an insurance policy, as I said earlier, to help you to cut all your odds back as far as you can. Does cognitive decline, so if you have a cognitive decline, does that mean you'll also go deaf? Not necessarily, but once again, there is a strong association. Next slide. And similarly, does hearing loss predict cognitive decline? Not necessarily. But there are a lot of pointers pointing the way to the fact that it's leaving you very, very vulnerable. Next slide, thanks. But intervention with a hearing aid can slow and reduce effects on the brain. Our friend Brian, what happened was that initially he'll cope by avoiding noisy restaurants. That's usually the first sign. Then he won't want to go to noisy dinner parties. Then he won't feel like going out much, and then the quality of his life deteriorates. Then he'll become depressed, and he's then at 5 times the risk of early onset dementia. He's retracted from grumpiness to isolation because spontaneous conversation is difficult for him, and he'd rather read anyway. So the summary today is use it, meaning your brain, or lose it, meaning your brain cells. The longer you delay, the harder hearing difficulties are to treat. Hearing loss is associated with cognitive decline, but not cause and effect. Treating hearing loss can improve cognitive function, and untreated hearing loss can lead to social isolation, fatigue, depression, anxiety and early retirement, all of which can also change the quality of life and lead to an early death. And there are some very good studies that show this. So a positive attitude about aging reduces the risk of dementia. And last of all, 90% of people with dementia also live with hearing loss. So there is some comorbidity of the two together. Now, a lovely lady, Helen Keller here, always said that blindness separates you from people, from things, but deafness separates you from people. And of the two disabilities, she would rather, if she had a choice, have been blind than deaf, because of that separateness from people that helps you to form those lovely connections in life. So conversation with those that we love help to protect our brain. It's the insurance policy that our brain needs to hedge our bets and make sure we get it all right. Hearing connects us to the people we love, and hearing helps us to share those innermost thoughts and feelings that are so important as the basis of relationship. So conversation with those we love actually can protect the brain.